fun. We wanted to make sure, since we couldn't be available at the booth at all times, a specific way to be able to get this information to you in another route. So one of the most important things we want to make sure that everybody knows is there's going to be a new rule starting on April 1st, that there's not going to be any visitors into the dialysis room area itself. That is there for a couple of different safety issues for sure, and we just wanted to make sure, I have it here for you to read through yet too, to make sure you know that it is a safety issue. The rooms are very tight. It is difficult for visitors to manipulate and actually for us to safely provide a treatment if you have visitors also sitting within the room. So we have made this new ruling coming up as a means of making sure that we keep everybody safe in the dialysis room. One of the other things that we have now too is there is a special way to get into your hemodialysis education. And so I wanted to make sure that you get a chance to look at this. So when you're in Epic itself, if you go to the web links, which is on the top line, and you open that up, I'm just gonna do it like that, make it bigger, so you can see. And if you go down to where it has Aurora Patient System Patient Education for your well-beings, if you click on that piece itself, and now you can go into the CRAMES. So if you search for the CRAMES and for your well-beings and you click on that piece, it's taking its time, so hang in there with me. From there, you have all the different folders. This is just the CRAMES information in here and the for your well-beings. So what you want to do is you want to go down to nephrology, and you can click on the folder for nephrology. It will open up to the acute dialysis area, and you can open that one up further. And you can see that there are a number of different areas about kidney physiology, diseases, dialysis therapies, complications, coping, fluid management, and nutrition. So you can pick the special things in relationship to it. So if I went into this different one on coping and I hit this anemia and kidney disease, so you can see here that this would go this way. Again, remember, it has it in different languages. So if there are different languages available for this, it would show underneath there. And you can go ahead and print it. You can also put the patient's name and also personalize any kind of special instructions if there was with it, and then print it. So this is one way to get some different information specific. It goes through it here so you can see the pictures and enlarges it when we're looking at it. There's also another thing that people have really liked to have in relationship to it, and they ask us a lot of times, is all about dialysis of drugs. So I want to make sure that you know that in this 5th tab here, where it has the dashboards, that if you go into the dashboards and you go all the way down to the bottom on the right hand side, I just have to get it to go. If you go under hemodialysis web links, you'll see that there is one for dialysis of drugs, and you can actually go into it and you can look for yourself about dialysis of drugs and what ones are being dialyzed out or not. One of the most important things to remember when we are looking at this is that the type of dialysis that we do is called a high permeable. And so please don't utilize the other rows for what we're looking at. And so if there's no data, we usually consider that to be that it is dialyzed out as a means of making sure. So we have some information here in case you're looking for that in that aspect. One of the other things that we have that's come up as some questions recently is a basic care of a dialysis catheter, and especially in relationship to showering. So this is the information that a patient would be getting in relationship to it. For our catheters, they should be, there should be a plastic piece that's placed over the ports and the dressing itself. The patients are encouraged to use press and seal like you use in the kitchen, and they are to cover it. That covering is non-porous, so it doesn't allow water to go in. And so what they need to do is make sure that they turn so that the water doesn't get directly onto the access piece itself. And when they're done with their shower, then they should peel it off. If at any point in time that you guys would be doing something and the dressing would get wet, you need to really make sure that you go ahead and change the dressing at that time. One piece that everybody should know is these are central lines. That means they're changed with the dressings that we have. If you have a dressing catheter kit, it has a bigger hold dialysis bio patch, and that should be the dressing that is utilized for our sites. So anybody can change the dressing, but so the question would be, can you use the ports? The ports are only usable if you have a physician's order to use the dialysis ports. So we really don't encourage that whatsoever. That is something that we like to make sure that you're well aware of. Some of the other things sometimes that come up, and I wanted to go into this patient's chart. If our patient has a dialysis schedule, and we usually do put in the schedule for our patients the night before, if we are aware that the patient is going to be coming for dialysis, or we're coming to them for dialysis, it is important to know that under the summary and patient story, that you can go down to the timeline and you would be able to see the event that dialysis is scheduled for them. It is really important when we're talking about dialysis before we come, and we should be calling you the night before and the morning of, if it's a first shift one. It is really important to make sure that the patient gets the opportunity to eat. So getting an early breakfast tray is critical to the patient. We don't want them missing food, but it is certainly important to make sure that is being done before we arrive. So making sure that the patient has a chance to eat, that they've gotten the opportunity to be toileted, because those are some other things that are much more difficult once the patient's on the treatment. So don't forget, if the patient is in need of pain, you should certainly give them pain medication in relationship to that. Verbal reports are really required from you guys to us, and from us to you at the end of the treatment. So part of this is really making sure that you're letting us know about any kind of labs, any kind of special drips that are hanging, any kind of things that can affect the treatment. So if a patient is NPO, that would be another important thing to make sure that we're well aware of. So just want to make sure that we get those things situated. If the patient's coming to the dialysis room, again, a ticket to ride should be done, and it should have your name and number on it so that it'll make it easier for us to contact you at the end. One of the other important things with all of this is access. All of our accesses, if the patients have fistula or graft, they should have a limb alert bracelet on there. I know that is pretty much done a great deal of time, but when you have new patients and stuff, it's something that can be forgotten and don't always realize. So it is going to be real important to make sure that the limb alerts get on all of those different things. As far as scheduling, again, if the patient is scheduled, you should see in your summary and in your summary and patient story, under the timeline area, that the patient is scheduled for dialysis. We try to, like I said, make sure that everything is done. Again, we have our one set number. The lead number is up here, 649-6790. They coordinate the staff. They set things up. So again, if there's any kind of questions related to a patient's treatment or something being done, those are the people that you really need to make sure that you call. That phone is only available until like 6 o'clock. After that, it goes to the answering line, and then we'd be catching it in the morning. So I just want to make sure, usually that room is closed by a specific period of time, and patients in the room are not being done in the middle of the night in that area. One of the other important things for our patients is all about diet and fluids. So just to make sure, patients are not allowed to eat during dialysis. This causes blood to go to the GI tract in order to digest food, which makes it a lot less available for us during the treatment. So it creates potential hypotension for our patients. Again, the patient could then have nausea and vomiting and could aspirate. So we really want to make sure that you know too, we don't allow eating prior. That's why please get the meals before they come, or else the next time is going to be after their treatment is completed. Phosphate binders are an important aspect to all of our patients' treatment, and so they're important in removing phosphorus and not having it build up in the patient's bloodstream. So the binders need to be given with meals. So it's very important. That's when you eat, so that's when it gets absorbed, and that's why it's important that whenever they eat, that's the medication that needs to be done. Our patients, a lot of our patients are diabetics, so it's going to be another important thing to make sure you know that when we're treating hypoglycemia, orange juice is not the one of choice. Please make sure that you have apple juice and cranberry juice. Either one of those, which are lower in potassium, would be important for our patients. So we just want to make sure that we're not compounding any problem that they have by increasing potassium along with it. We do have special consents. Again, if you're finding that you're not having them, if you let the leads know that you don't have them on the floor, we can work to get them up there for you. But they should be available for everyone. There's special consents with just the word hemodialysis on it, and it does talk about risks and benefits. So if a patient has a need for consent, just so you know, if there is a consent and you guys are going to be getting it, there will be 2 witnesses that will be required for that process. So if you only have one, it doesn't count for us. We'll be redoing consents, and so we're really pretty careful about what we're doing with the consents. Labs. Labs are another important thing. We want to do them before the patient goes on. A lot of labs can be affected the minute the patient even starts the treatment. And so labs, especially electrolytes and hemoglobin or hematocrit, these are ones that are really critical to be done before the patient goes on. There are some labs that can be drawn during the treatment, so like troponins and heparin levels and different levels for PT and PTINR. Those things can be done still during the treatment, but it is an important thing to make sure that you're aware that other ones shouldn't be. And we do like to wait up to 2 hours post-treatment because we need the patient's system to balance out before, otherwise you'll have labs that either show incredibly lower or incredibly higher than they really in actuality are. And we don't want patients to be treated for something that really isn't appropriate at the time. So these are important things. I did kind of mention to you that we have the different ways to find about dialyzability of drugs, but I do want to kind of put out there one important thing. All drugs aren't held for dialysis. That includes blood pressure medications. So it would be important though to find out if you have a patient that's running a lower blood pressure, it would be important to talk to your nephrologist and please find out what he would like to do in relationship to it. That information that they give you in relationship to the medication and stuff should be listed under the instructions. So again, when you're pulling up the medication and you're looking at it, you can put in the specific information in relationship to dialysis with it. So it is important now, because sometimes people think, oh, this med is for blood pressure and I would want to hold it. But that med could have been given for a rhythm change or other issues. And so we want to make sure that we're not creating more problems for our patient. So even if it's the cardiologist that you need to speak to find out, that would be important. Part of what's going to be important when you talk to them is the frequency of the drug. If the drug is 3 times a day, that might make it very important to give. So please take a look at that. We want to maintain blood levels of drugs and everything too. And so dialyzability isn't always the only aspect that we look at, and sometimes even if it's dialyzed out, we may still choose to give it if it's something that's given 3 or 4 times a day. Just so you know too, as a final point, daily weights are required pre and post. We will be doing them if the patient is done at the bedside, but if the patient is coming into the dialysis room, the expectation would be that the floors would be doing the weight pre and post. So that's kind of the information that we have. If you have some different questions or concerns, I will spell you my name so you can email me, and I would certainly do the best I can to get back to you as quickly as possible. So the first name is Mary, and the last name is Schopbach, SCHOPBACH @aurora.org. So please, I'm the educator there for the hemodialysis area, and I'm certainly available for questions that are not of grave concern or need to be answered very quickly. So I appreciate your time and effort.